So shall I proceed? Mr. Johnson, are you there?
Let me do the introduction, then you can start.
Okay.
Okay, guys. You are highly welcome to today's workshop. Today we'll be discussing suspension trauma, and my name still remains Johnson Wala. So this workshop, Safeoclock workshop, is exactly where we health and safety professionals we gather together virtually to discuss specific topics for the week. So this week we'll be talking about suspension trauma, and as Stephen will be leading the discussion, and as our culture has always been, there will be time for everyone to contribute. Is a personal experience. You can share your personal experience and the lesson learned. Maybe if there were incidents you witnessed or you've investigated, you can share with us the lesson learned. And if there are other good or best practice that are being implemented in your workplace, is an opportunity to share with us as well. So that is what we do here every week. So today we are talking about suspension trauma, and Mr. Stephen will be leading the discussion. Okay, Stephen, over to you.
Good evening, everyone that are here on this platform today. Like Mr. Justin had said, my name is Stephen Francis Ogogo. So I will be leading this topic of this workshop today, which is called Suspension Trauma, Understanding the Danger and Staying Safe. Now, if we can see what we have on the screen here, we'll understand what, we might just have a pictorial view of what we're about to talk about. Now, the agenda for today's discussion will be a brief introduction to suspension trauma. Within this introduction, we'll briefly look at what we call the pathophysiology and chemistry of suspension trauma. What happens during the period of suspension trauma? What are the pathophysiology that happens within the body system? What chemical reaction also occur that might lead to the risk of suspension trauma? And we'll also look at the progression of suspension trauma, and also what are the causes and other risk factors that that are available that might prolong or induce such a risk of an individual who is caught suspended while using an harness. And also we will be looking at some symptoms and consequences of suspension trauma. And also we're going to look at a preventive safety measure that can be deployed as a health and safety practitioner. And also we'll look at some case studies or relevant study as the case may be. Then we'll be having a conclusion on the subject matter. And if there's going to be any clarification from any participants and also contribution, there will be a room for that. Now, on the introduction, we know that in fall protection, arresting a fall is only the first step in preventing injury or death, okay, when working at extreme heights. So even in the arrest, even if the arrest does not cause injury, a falling worker can die from suspension trauma, which is also called orthostatic shock, if not rescued on time, okay? So too often, a worker is saved by a personal fall arrest system, okay, but at some extent they are being succumbed to a suspension trauma while awaiting rescue to take place. Although suspension trauma, as we all know, is potentially life-threatening, and there's a lack of scientific data precisely or empirical data to define the exact mechanism of injury. And there are also little conclusive evidence about the proper management of victims after being rescued This has led to a lot of controversy over the decades, on the topic of post-suspension management, because there are some arguments. So some facts that are available are just like an hypothesis. So there's no experimental or scientific experiment to determine this. But as we go on, we'll be seeing some things based on hypotheses and that are available. And also, this discussion of suspension trauma has historically been led by non-medical experts. But the recent push for more evidence-based research has created a better understanding of such condition called suspension trauma. Because if we look at most information that are available or that we can use as a few data available, they are done by non-medical experts. Maybe probably people like us that are in the health and safety field, who are not a medical practitioner to be specific. So, when we look at suspension trauma, once such happens, it has to be an hospital issue. So we need more of evidence within the medical area to ascertain some statistical data or empirical data to this subject of discussion. Okay, now when we talk about suspension trauma, for example, when we look at the image we have here, it's showing us the lower extremity of the human body, okay, which is the lower limb, the leg, from your leg downwards. And if we see the image showing us the posterior and anterior view of the thigh, of the human thigh, and from the anterior aspect, we will see the artery, which is called the femoral artery, while that at the posterior level is known as the femoral vein. And from our elementary biology and all that, we know what an artery should do and what a vein should be able to do. An artery will take blood to distribute to other part of the body, while the vein will return it back for recirculation and all that. So what happened during suspension trauma? And as we also know that suspension trauma is also known as harness-induced pathology. Sometimes they are called harness-hang syndrome and orthostatic intolerance or shock. It occurs after a worker has fallen into a fall arrest harness and is suspended for a short period of time, in an hanging position until rescue arrives. Now, when hanging in a fall harness, the leg strap, there's what we call leg strap. When you look at this is harness, this is the leg strap of an harness, okay? We're just trying to project it for you to understand what the effect is, because when somebody fall while he's using harness, you discover that he falls with a force. And at a particular time, when that person is suspended, there will be an obstruction of these vital blood vessels, the arteries and the vein. And we know how large and important the femoral arteries and vein are within the lower extremity. So when this thing happens and the person is hanging on a vertical position, you discover that all the weight will rest, all the weight will rest on, all the body weight will rest on the leg strap, okay? So thereby causing some kind of obstruction between the vessel. So now, for us to have a kind of brief understanding about the pathophysiological mechanism of suspension trauma, you see, during suspension time, okay, what we mean by suspension time is that once the person drop or fall from height and is suspended on his harness, you discover that the time it takes for rescue to occur, okay, so this period is called suspension time. So it varies. It depends on what plan that are available. It takes 30 minutes, it might take 1 hour. So these are the things we're going to be looking at in order to manage such kind of situation. So during suspension time, the leg strap of the fall protection harness crushes the femoral arteries inside the leg, cutting off blood circulation. Like I've said, it depends on the intensity of fall, depends on the distance. Okay, so all those things will determine how the effect will be on the individual who is caught under suspension. So additionally, the leg muscles are relaxed vein in the leg expand dramatically, okay, through a process called vasodilation. What vasodilation does is that when something expands, there's supposed to be constriction and dilation during the process of receiving and pumping out. But in this case, there will be a dilation. It will just open without contraction. And once that happens, you discover that all the blood just flows down. Like from the image we could see here, okay, we could see that the contracted skeletal muscle. During suspension trauma, the muscle will not be able to contract because it is contraction that will help the vessel to push the vein from the lower limbs, from the lower extremity back to the lung and the heart, okay, for recirculation purpose, okay? So now when you look at this image here, this is a normal situation that is supposed to occur without obstruction of the vein, okay? But in this case, you could see that because there was a kind of obstruction or inability for the muscle to contract due to suspension trauma of a walker, you discover that the vessel become dilated, which I've said earlier, it becomes dilated instead of constricted. And what causes that dilation is that the muscles are already relaxed, okay? Because it is when the muscle contracts, like in the first image, you see that it can pump blood due to the arrow you can find here. But in this case, during suspension trauma, this is what happens. Instead of blood to return through vasoconstriction, instead there's a dilation, vasodilation, the vessel expand, and there's a lot of blood being stored at the lower level. So we'll not understand what's happened because the leg muscles are not being used to stand during suspension trauma. They are not contracting and therefore not preventing the vein from expanding. Now, this lack of constriction from the leg muscles allow blood to gather in the leg rather than returning to the heart and lungs for recirculation, like I've said earlier, through a process called venous pooling. Because if such condition happen, it means there's a venous pooling. What means is that there's a pool. When somebody says there's a pool of blood, there's a lot of blood, at that level of the lower extremity. So when that happens, you discover that the blood cannot recirculate back because as the human system is, blood needs to go. It needs to go in circulation. It goes up and come down like that, depending on how the body uses it for its various functions. So without constraint from the leg muscle, the expansion of the blood veins in the leg can result to about 25% loss of blood circulation. Because there's an obstruction, the blood is not going back to the other part of the body. So there will be loss of blood circulation. These are just common sense. Okay, so loss of circulation could cause heart to work harder because there's a less blood supply to the heart. So the heart will tend to, because it needs to meet the demand of the brain and other part of the body. So it gives the heart more task, to do, to pump and all that, to keep the brain and vital organs supplied with blood. So as a result of that, this will agitate the heart to try to work more than what it's supposed to do. So now what happened during this venous pooling, when the blood goes down and circulates and stored within the vein at the lower extremity, what happens is that there are some chemical reaction that takes place. Okay, so when the blood pool becomes trapped in the lower extremity, the blood can no longer deliver oxygen from the lungs. Okay, so to continue producing energy to sustain life, which are some cells which are available within the body system, the lower extremity undergo what we call anaerobic respiration. For most of us who did biology, I believe everybody did biology in their elementary or secondary, we discover that in anaerobic respiration, this is a kind of respiration that takes place without oxygen. Okay, so during anaerobic respiration, there's a glucose because every human, our blood has a glucose or a blood sugar, okay, which is a source of energy for the body cells to carry out functions, to work and do other things. So in the case of suspension trauma as a result of obstruction. Oxygens are not coming in. So what happened is that the available blood at the lower extremity, because it needs oxygen to function and it's not available, so it will undergo a chemical reaction. Okay, and once this chemical reaction occur through a process called lactic acidosis, during this process, what happens is that the blood sugar which are available within the blood will break down into two equal parts or half, and these products are called the lactic acid. Okay, so what happened during this process that there will be a buildup of this lactic acid within the blood at this lower extremity. Okay, so now the blood is not circulated or not being circulated to other part of the body, so it just remains within the lower extremity. So, and once all this thing build up, it becomes stagnant, and this lactic acid becomes so toxic because it's an acid. Naturally, it's not supposed to exist or occur at that particular point or instances, but as a result of being suspended after fall, so you discover that within the pool of blood, we'll find a lot of lactic acid present in that pool of blood and makes the blood to be toxic or acidic. Okay, so until when the worker is maybe rescued, when the worker is rescued, the strap, the leg strap, all those things would have been released from the worker. So there's always a kind of reflux, a reflux. Those blood that have been accumulated there will start flowing back to the lungs and the hearts for other functioning. So there are some the high level of acid flooding the body can overwhelm the kidney, the liver, and may also result into heart failure because then it's taking a lot of acid blood containing materials back to the vital organs, which could actually damage this vital organ as I've explained. Then if we could see this chemical, the structure here, we explain what I've tried to say. This is a structure of a glucose, and once lactic acidosis occur, it breaks down to two lactic acid in such processes. So this is a brief explanation of the chemistry, what happened during suspension trauma. These things might look so, we just say suspension trauma, so a lot of things happen. Okay, so now during this progression, during this period of suspension trauma, there are a lot of things that happen. The strap impedes the blood return to other parts of the body, like I've said. The muscle venous pump fails, inability to pump blood to other parts of the body. The blood collects in large leg muscle. Decreased blood return to the heart. Blood becomes toxic and highly acidic. Okay, so at the level of the lower limb circulation, then when you get to the heart level in terms of circulation, all these things will result to anxiety and the onset of shock. Okay, and the heart rate will increase, cardiac irritability will set in, the body reflex reduce the heart rate and the blood pressure as well. Why the heart keep pumping action to reduce because of decreased blood return. Okay, so at the level of the brain, which is another vital organ for human survival, there will be a diminished blood flow to the brain. So the blood flow to the brain decrease, the victim will lose consciousness, there will also be a blocked airways, and cardiac arrest might set in, and eventually death will occur, depending on the duration of what happened. So now I would just want to play this short video for us to have an overview of what I'm trying to explain so far. Oh, I believe we could hear the audio of this video. I believe that, huh? Hello, Mr. Johnson?
Yeah, it was soundless. There was no.
I'm sorry about that. I'm just trying to, I don't know. So maybe.
No problem, we can go ahead.
Okay, so at least even for the fact that it was soundless, we could just, what this video is trying to tell us is that we'll be coming about the safety strap, okay? You know, during suspension, what happened is that there are some device which is called the safety strap, okay, which are attached to most recent design harness, you know, to be able to allow you during fall to be able to make movement of your leg, you know, and to stretch yourself so that you will not be, this will reduce the effect of the suspension effect pending when there will be a rescue. So we'll come to that later. So, but basically when we look at suspension, we have to look at the cause and other risk factor. Okay, so there cannot be suspension trauma without fall from height. Okay, so one of the major cause of suspension trauma is fall from height. You know, when we carry out an activity, there are a lot of activity. You are working on an high rise. Those people who are mountain climbers, those people who do it for recreational purpose, those people who work in the caves, you know, and those who goes to mountain doing some kind of research, all those mountain engineers and all that. So a lot of activity which involve people using harness. Okay, not just a work at height, they are walking 2 meters and thereabout. So, but these are very extreme height work that you must go with an harness. Okay, so in such cases, fall could occur. Okay, so these are this is one of the major causes of suspension trauma. And another cause again is delay, rescue delay. Okay, because if somebody is rescued on time, there will not be an issue. There will not be what will cause suspension trauma in the first instance. So in most cases, when there's a delay in rescue, it brings about the issue or the condition or risk called suspension trauma. So now there are other predisposing factors which expose individual, you know, who are suspended on an harness to suspension trauma. Okay, so all these factors are like the age of an individual, you know, because the older an individual, he or he, you know, you have a poor cardiac and arterial function, because as you begins to grow old, you discover that the function of your heart will begin to depreciate as compared to when you are young. So we could see that you cannot compare somebody who fall on an harness, is suspended. If I can stay on a suspension for 20 minutes, another person who is older, 20 years older than me, might not be able to survive that 20 minutes. Okay, so the trauma can set in. Okay, so that is the difference when it comes to age. And also height, suspension more than 5 feet from the ground level is at high risk of suspension trauma as well. Okay, so also the severity of injury, because in most cases, when you fall, one can sustain injury, which is different from the suspension trauma itself. Okay, because the suspension trauma is as a result of delay in rescue. So the trauma can set in. But in the case of the fall, depending on the distance, the person can fall and just have, maybe his muscle got torn and things like that, depending on the force, that is being exerted at that point in time. So, or maybe when the person is falling, there's a swing and it got hit on an object and things like that. So the person might sustain severe kind of injury along the line of fall. So at that point, it will increase the chances of suspension trauma of such an individual as compared to someone who just fall without making impact with other stationary object. So, and even suspension time, okay, according to 2006 OSHA guideline, recommend not more than 30 minutes of suspension time. You should not exceed, 30 minutes. It's just like an average, okay? So the suspension time is also another factor, like I've said, and all this are subject to other factors, like I've said. So the time varies. If I can survive 20 minutes before entering suspension trauma, another person might just have just five minutes, to enter suspension trauma. So it all varies, but be that as it may, we could also see that the type of harness also is a factor, because we could see that we have different kind of harness, some old form of harness which has a chest, where the anchoring is at the chest level. We have the dorsal type, we have the seat type positioning, and the full body harness, which we are more familiar with. Okay, so there are some researchers who did some work, Beverly et al. They reported that and concluded that the full body harness was the best tolerated as compared to others, which there's a range between 5 to 30 minutes. Okay, when compared to maybe probably the dorsal or the belt type of harness. So the harness type is also a factor. If you go and get an harness where the anchor is at the front here, you discover that when the person falls, there will be a pressure within the heart and all that. So it has a big effect. All these were the ones that were using those days as compared to the recent type that we have at the present time. And also another factor we should consider is the weight, because the increased weight, has led to decreased mean of arterial pressure, because when you have more weight, you discover that when you are suspended, the arterial pressure, as compared to somebody who does not have much weight, will be different. So somebody who is overweight, somebody who is obese, you just want to imagine what will happen when that person fall and being hanged on harness, he will experience suspension trauma within a short possible time. And also, when you look at what I have here, there's what we call the upper and lower torso depth. The depth, between your back and there's what we call the sternum here. Some people are very big, they have a very large, while some people are very, very slim. So, so the larger or the slimmer it is, the less tolerance type you have. Okay, so, and also the harness fit, so the harness should be able to fit an individual. The fitting is very, very important, because the tie strap angle, when the tie strap angle is greater than 50%, because we will understand from this image, okay, because when the strap is not properly fit, does not properly fit the individual, when the persons fall, definitely the angle, okay, the strap angle will vary. But if it is well fitted, you will have an angle that is less than 50 degree. Okay, so but at a 50 degree greater, they're likely that the individual will have a tolerance time. Okay, because what we mean by tolerance time is that the time the person can tolerate before the onset, of this trauma. So when you have a greater angle of that, it will affect the individual, and also the suspension angle itself, because when the person drops from harness, if you see what I was trying to say, look at this kind of harness that is on this side. So the risk is very high, you could see, but these are the normal ones that we are familiar with. And once the person drop, if you are in an angle like this, suspension, this is what, like when you are suspended, when you are not in a vertical position like this, here you are in an angular form. Okay, so at this point, when the angle is greater than 35 degrees, you understand? So it's another factor that can affect the individual when it comes to suspension trauma. So generally, like I've said so far, the greater the height, the depth, the weight, the tie strap angle, the suspension angle of the suspended worker, the lower the tolerance time. Okay, so which means, what it means is that if all these things set in, where you're supposed to have a tolerance time of like maybe 30 to 20 minutes, you might be having a tolerance time, of 10 minutes, and which is very, very risky for the survival of the fallen worker. So when we have to look at the symptoms and consequence, of somebody who has or experiencing suspension trauma, there will be an anxiety, dyspnea, which is shortness of breath. There will be drop in the blood pressure and heart rate, and there will also be fatigue. There will be headache. There will be lightheadedness. There will be nausea. There will be heart palpitation. There will be sweating, unconsciousness, and weakness. There are so many because there's already a deprivation of oxygen, glucose, and other vital stuff going back to the lungs and the heart to supply other part of the vital organ and cells within the body. So all these things begin to set in. We know what it is for you to be even stressed at work. You know what happens, pressure, fatigue, and all that. So now imagine that somebody is being suspended on an harness for some time. Okay, now in rare cases, when we're looking at the consequence, in rare cases, there's what we call ischemic shock. Because of this obstruction, there will not be sufficient supply of oxygen to the brain. Okay, this could lead to shock. Is in a rare case scenario. Okay, so depending on when the person is being rescued, when being suspended. Okay, so I believe when the person is exposed to that suspension for a very long time, I think that will lead to this ischemic stroke we're talking about. And another thing that is common as a consequence of suspension trauma is fainting or shock, and it could be as a result of what we call hypovolemia, because the blood is not returning. There's no sufficient blood within the organ and other part of the system. Okay, it could be hypovolemic, it could be hypoglycemic in terms of the glucose level within the blood, because definitely it will affect the blood glucose level. Okay, there we'll be talking about hypoglycemia will set in. Then there's what we call cerebral hypoxia. So at that level, there will be no oxygen to the brain, to the cerebral probably cortex of the brain. So all these things, you could see what can happen to an individual if not properly rescued or taken care of when such person fall and being suspended on an harness. Also, we have an hypothesized fetal condition known as reflow syndrome. Most time it is called a rescue death. What happened is that when the person has been rescued, like I was trying to explain about the chemistry, because of the toxicity of the venous blood, okay, being accumulated within the pool of the blood in the venous level at the lower limb. So what happened is that once the person is rescued, okay, there is this hypothesis and belief that the blood will begin to reflow, or we undergo what we call a reflex kind of action, goes back to the upper part of the body. So in that case, because of the toxicity and all that, being that it affects other vital organs, the person might pass out at the end of the day. So thereby result to what we call rescue death. So the way and manner the person or the worker is being managed after rescue also matter. We'll be looking at that as we progress. Okay, and also there are detrimental effects which may damage the vital organ, like I've said, such as the kidney due to immobilization because of injury, neurological disorder, aging, dehydration, traumatic shock, or other non-FRFE transporter deficiency. These were research that was done by Robertson and Shannon et al. In the respective years. So if we could see all these things, we could know what could happen when somebody passed through a trauma, you know. So these are things as a professional we should have at the back of our mind when we are preparing a rescue plan. We don't just prepare a rescue plan without considering suspension trauma as a risk factor, especially when we carry out our risk assessment as well. All these things should be put into consideration, because if you don't put it in consideration, somebody just fall from height. How do you rescue such an individual? Before you begin to enter skater, try to look for a way to rescue the individual, you discover that the tolerance time will be exceeded. At the same time, this person will have a likelihood of sustaining all these consequences that are available on the slide. Okay, now we have some preventive measure, you know, we can take to curtail this situation. Okay, first of all, I believe before somebody will be subjected to working at an extreme height, such an individual should be checked health wisely. Like there need to be a kind of health or fitness check to determine if there's any underlying medical condition. Okay, because somebody who have natural high blood pressure fall from height and he gets suspended, we'll be talking about just 5 to 10 minutes. This person will just go into trauma. Okay, as compared to somebody who is healthy, who does not have any underlying medical condition. Some people, the problem could be on a neurological condition and all that, maybe kidney issues and all that. So fitness tests, health check, these things are very, very important at the onset of deploying workers, you know, to work in such an high-risk activity. Okay, and also we should also ensure that there's a proper PPE that is well fitted. Like I've said earlier, the PPE must be well fitted for the individual, because if a PPE is not well fitted, if it's too tight, if it's too loose, at the end of the day, when the person falls, the risks, the chances are high for suspension trauma. Now, another thing we need to put into consideration is that before using an harness in a live situation, okay, it is advisable that suspension testing should be carried out in a controlled environment so that an adjustment for fitting can be made if needed before the actual activity will take place. Now, another thing is provision of adjustable foot loops, okay, also known as relief straps, foot loops, I think I'm repeating it, foot loops or suspension trauma safety traps. From the video that was played earlier, you could see towards the end, the individual has to release these trauma safety traps. Okay, it is being attached on the left and right side. So once the person drop or fall from height in such a situation, this strap is designed, okay, to be able to help the individual to make movement of his foot, you know, to be able to flex his foot, because when the person drops from harness on a natural situation where he's standing on a vertical position, he does not have that ability to raise his leg, move his legs and all that. So with this trauma safety strap, once the person pull it, you know, he has to clip it together and he will put his foot there. The person can adjust himself according to how it was projected in the video. The person can stretch his leg, he can move his leg. Once he begins to do that, you discover that the blood will continue to flow, because then the initial muscle that was relaxed, or probably if the person initiate that immediately, there will be no cause for the muscle to relax, because the muscle will be contracting to pump blood back to the upper part of the body, while relaxing the effect of the harness strap that was that will probably constrict the femoral artery and vein, as the case may be, as we see in the structure I've projected earlier. So there must be provision for that. Okay, this is a new design safety PPE that is available, that people should be able to, as a professional, we should be able to advise if we find ourselves in an organization where there's always an extreme work at height activity like that. So we could suggest this, and because it will help this individual to do what we call self-rescue. You know, the person will be able to rescue himself pending when the rescue team will arrive. Okay, so having said this, there should be need for a thorough education and training, which must be provided to workers regarding the risk of suspension trauma, and they must be trained on self-rescue, like I've said. You know, how to pump the leg, how to provide lower limb support of their leg with the use of the relief strap or this trauma safety strap, as the case may be, until rescue team comes. Along with individual training, there's a larger system. Larger system should be in place, you know, for rescue and initial management of suspension of suspended individual. Okay, because it's very important. It's not about just bringing the person down. How to manage a person after it is brought down from rescue also matter, because that's what we call rescue death. If such kind of person is not properly managed, you know, so it could lead to death. That is why there's an hypothesis, you know, that says when the person is rescued, when it's brought down, it is advisable that the person is not placed horizontally. It is that the person should be put in a sitting position, because if the person is laid down, maybe on a stretcher on a horizontal level, the effect of flow, you know, could affect those organs based on the hypotheses that have been available. So it is advisable that the person is rescued on a kind of rescue equipment that looks like a wheelchair. Okay, so that will be able to make the person survive rescue death at the end of the day. So if you could see from this image, you could see that what they are using to rescue this guy. Look at the position. I think from the hypothesis so far, this is how it should be. Okay, this is how to be able to manage such an individual once the person is brought down, instead of the person to just lie in a supine horizontal position. The effect will be detrimental. So it is always advisable that such way of taking the person for a medical attention should be deployed. Okay, so, and the rescue, if a worker falls and the force of the impact is greater enough, the worker may pass out. Okay, the chances that the worker may pass out is there. In this case, the worker will not be able to deploy the trauma or relief strap, as the case may be, you know, in that hanging position with the harness, but without leg support until the help arrives. Okay, so because of this, it is important to have a rescue plan. As a professional, we should have a rescue plan. And in this rescue plan, there must be a provision. Okay, there must be a provision of how people will be rescued. There should be a consideration of suspension trauma, as the case may be. And also, OSHA has identified that suspension trauma could be fatal within 30 minutes of initial fall. So this 30-minute window is what OSHA refers to when it says that fall protection plan must contain plan for prompt rescue. So these things should not be negotiable. It should be available. As a professional, we need to advise our individual organization when we find out that the kind of activity they are doing is of an extreme height. Okay, so there are some case or relevant studies. Okay, now there is this, due to lack of general empirical data, like I've said earlier, available regarding the actual suspension casualties. There's a lack of clear consensus, okay, on how quickly a person in distress must be rescued. Okay, nonetheless, the prevailing consensus is that rescue must promptly and effectively be carried out as soon as possible when a fall arises, you know, for the benefit of the suspended victim who have experienced this fall arrest. Okay, of the limited studies that are available on record that addresses suspension tolerance time, 2 such studies published more recently in 2012 and 2015 with a modest number of participants of 40 and 37 respectively, were referenced approximately about 29 minutes on the average of suspension time. So we could see that it's in line with what OSHA is recommended or recommended so far. Okay, so they have a suspended tolerated time of 29 minutes. However, it is important to note that both studies did not involve a fall event prior to the suspension. These are just voluntary people. They just go, just like you are doing a suspension testing. They did not have an actual fall. Okay, so if there's an actual fall, there's the force is also an effect, which you might likely to have a less tolerance time. Okay, so if you understand this, and the tolerance time vary from individual to individual factor, which I have mentioned earlier, like the age, the height, the body size, and all that. So all those factors will play into determine how an individual tolerance time will be. Okay, so previously there's this Damage and Schwa in 1985. They performed 46 suspension tests on various types of harness for up to 10 minutes. No one lost consciousness, but 2 individuals with harness with dorsal hook had to stop tests by presenting undetectable blood pressure between 5 to 9 minutes of suspension. So we'll see we'll understand what that means. Then the first series of cases of death due to suspension trauma syndrome was published in 1970. A research group studied the cause of death in 10 climbers, mountain climbers, okay, with no physical injury, who were suspended on their harness from 90 minutes up to 8 hours. 8 patients were rescued and extricated and survived from 30 minutes to 11 days. After they are rescued, they eventually passed out, okay? Because the hypothesis suggests that it is the effect of the suspension they sustained, okay? The suspension trauma they sustained. Why in 1972, another series of cases were published in which 10 out of 23 climbers died after being suspended on their harness, although they did not suffer any traumatic injury, like physical injury like fracture or solid organ damage during fall. So in conclusion, as a professional, we should have a rescue plan to prevent suspension trauma. The harness stops the fall, but hanging too long can be deadly. Before work begins, we have to train our workers on self-assisted rescue with the strap, which I've said earlier, and provide also a rescue equipment. It is not when the fall happens, we'll be looking for equipment. There should be a standby equipment for rescue, okay? And after fall, we need to initiate the rescue plan that are available to immediately rescue these workers, okay? And also, we can initiate the call of an emergency situation. So thank you very much for listening. I would really appreciate if we have any contribution or anything we want to know about regarding this topic that I've said so far. I know our time is fast spent, but at least we have a few time to still ask 1 or 2 questions and also make 1 or 2 contributions. And all these things I've said also, there's a references as I presented here. All this information were extracted from all this reference document. I'll say thank you once again for giving me the opportunity to give this presentation. Thank you very much. Mr. Johnson, over to you.
All right, sir. Thank you, Mr. Stephen. That was a very wonderful and detailed presentation. So this time for personal contributions and experience. If you had some experience that you need to share with us, you can share with us. We still have 8 minutes more to end our session today. So personally, I want to comment on the treatment of suspension trauma. One thing is the rescue, another thing is the treatment. Just like Stephen has said, if you did not do the right thing, or if the right thing was not done after the rescue, you endanger the life of the worker the more. So just like he has said that there could be a rebound or reflow of the accumulated toxins due to the suspension trauma. So what it simply means is that the medical practitioner should be part of the rescue team or the rescue plan. So in the workplace, everything must not be done by the safety team. Everything must not be carried out by the safety team. You should bring professionals in the team. While preparing your rescue plan or your rescue procedures, you should include the relevant qualified personnel that will be useful in the event of rescue. So the medical team or the site nurse, as the case may be, should be part of the rescue team and should be available to do what is right to ensure that the rescued victim does not go into shock or maybe develop after rescue effects or injuries due to poor management of the rescued victim. So this is what I want to contribute, and I will give the floor open to others.
Mr. Olufemi, where's Mr. Andrew? Please, we want to hear your 1 or 2 inputs before the section ends.
Okay, Mr. Andrew should go first.
Yeah, thank you. Mr. Steve, thank you for the extensive and detailed presentation. You know, these things are real and factual, and it should not be taken for granted because from all we have learned today, it is a very high risk situation where somebody fall and suspended. So for my own take, I will just comment on what I have learned and what we should do as safety personnel. As Mr. Justin has rightly said, most time we absorb the whole thing, and when this incident happen, we don't really know how to, we will not really have the technical knowledge regarding the aspect of health and the effect. Because just as Mr. Stephen has said, we are not medical personnel. And most of us, we have left biology for a very long time. So it's just a kind of a reflection and listening about the big biological terms. So that's why this platform is very good. You will remember your secondary school days and even your elementary school days again. So it's not just all about, we are looking at the physical aspect of the health and safety. So yes, the site nurse, just as Mr. Justin has said, or the medical expert should be involved in rescue procedure. And for the health and safety personnel, for me, I will want to say, if people are working at height, looking, there's possibility of this eventuality happening, people falling and all that. But to avoid us being in that situation, because it's not, because most sites that we work, you see, we make the emergency situation and the rescue plan and all that, but the machinery, the equipment are not in place for rescue. Am I right? Yeah. For my experience, most times these things are on paper, but very difficult to implement.
Yeah, very correct.
So,
very correct.
Yeah. So I will encourage that we have to, from the take off from this lesson, this training, we should ensure that the rescue plan is effectively implemented, because sometimes we think it will not happen. It definitely, or by chance, it may happen. Thank you. That is my own take.
All right. Thank you, Mr. Andrew, for that wonderful contribution. Stephanie.
Femi, it's over to you.
Femi, the floor is open. Okay, maybe it's not around. Any other person that wants to contribute can take up the floor.
Hello, good, good evening, everyone.
Good evening.
Yeah, my name is Donald. I first of all want to comment Mr. Stephen, on this detailed and elaborative presentation. So like people normally say, we learn every day, and for all of us, most of us, in the field of health and safety, I believe suspension trauma shouldn't be a new thing to all of us. So the way you are diving into it, in detail, explaining everything, from the inception, like from the time someone is exposed to risk of falling from height or someone is suspended, and I would really like to comment on the rescue aspect of it. Okay, because when I worked in Razabu Fontas in this addition project, we had like kind of a suspension text, and just for us to text, first of all, it's not just about having emergency rescue or response plan, but same way we do emergency response for office and for site. So there's need for us also to conduct this to text our system and know if it's effective by conducting emergency response plan for fall from height. And this will tell you, okay, if the emergency response time, but in most cases like 5 minutes, are met. Okay, I'm just hearing about this 30 minutes window by OSHA, which, like I said, we learn every day. So normally it's about 5 minutes. And like Mr. Stephen rightly said, it all depends on the fall distance and the impact, the weight of the worker. Okay, so in the event of fall, or let's say during the emergency response what's it called again? Drill that'll be conducted for rescue from height. So this will, like kind of test the system in place, the response time. If there's equipment, like in most cases, people use MUP, that's a mobile elevated working platform to rescue a suspended worker. From height. Like my brother, Mr. Matthew, just said, and in most cases, you don't find this equipment readily available at site. Okay, they only exist on the paper. So if we have all these as safety professionals, if you are truthful for ourselves and before any work at height is being done, if you ensure that all these rescue equipment are in place, including the wheelchair, that was made mention that for someone that is exposed to also someone that is exposed to risk of suspension trauma should be rescued with, is readily available aside. So this will help and minimize suspension death. So this is my humble contribution.
All right, thank you very much, Mr. Donald. That was great. Okay. Mr. Francis, I'll give you the.
Okay. I'm available now.
I will come back. Now? I will come back to you, Mr. Femi. I will call you.
Okay.
Yeah.
Yeah. Sorry, I was emotional. I don't know. Okay, I'll wait.
Yeah. Please, Francis, go ahead. Yeah. Francis, you are raising your hand. Can you go ahead?
Femi should come in, please.
Femi, please go ahead.
Okay, thank you, everybody. Thank you, Mr. Safeoclock. Thank you, Mr. Stephen, as always. You never fall out hand. I always love you teaching, as in I love your teaching. Regarding the topic, to be honest, most companies, they will have a rescue plan, but the aftermath, like this, maybe the trauma, the person or the operatives might encounter after maybe surviving, and some don't, about most occasions, those that survived it, the aftermath, like maybe the trauma that the person maybe might have have or undergone, the most companies don't have this kind of provision in place. Maximum, they will just okay, take you to hospital. Okay, is the fine? Is he having a BP? Check his sugar level is okay. Then maybe second, third week, third day, they will throw the person back to work. They will not even check maybe he's traumatized or nothing. It happens. I've seen it happen many times. I'm fine. And he too maybe is scared of maybe losing his job or something like that. We'll just say, okay, I'm fine. Then he will just come back to work. Then anytime he's on that working at height, that thing will be definitely, he's human. It will surely come back to him. That, oh, maybe I might fall again. He might be scared to work, but the kind of maybe environment that he's working, I don't want to lose my job. I have to continue. I pretend I'm fine. So it's good to have it in place, and good, like Mr. Donald, I said that test it often, maybe through a drill, not just once in a while, like normal fire drill we do, like 3 to 6 months. If it can be done, it will be very good thing. It will be very good to the employee and the company as well. It's to protect their image. So I missed some part of the training, but I trust Mr. Safeoclock is going to share the slide, because I would love to have to go over it again, and maybe for other people that wants to have it as well. I trust Mr. Stephen, he would love to share the slide with us as well.
Absolutely, absolutely.
So it's been a while here. I miss everybody. I miss Stephen. I miss Mr. Safeoclock. I'll call him that. So I hopefully I should be fully back maybe by next week. God spare our life. Let's bring on another topic, so we should impact people, share knowledge.
We'll miss you also. We are glad to have you.
All right, thank you, everybody.
You want to add something? Quickly add.
Before anybody can come in, let me just say something. Yeah, most of us have made some contributions saying, most of us in our organization, we have this plan, but in terms of the rescue equipment and all that are not in place. You see, yes, most of the time we find ourselves in a challenging organization, but still, for the fact that some of us believe that some organizations are adamant, some are being adamant out of ignorance. Not all. Some understand, but some they do not understand. That is why, as a professional, if we have this opportunity where we give presentation to part of the management team, I think this will be a kind of eye-opener. Okay, we have to give such kind of presentation where we'll have a video of a scenario, where suspension trauma occurs and what happens, So because, sometimes it's just like, as we are here, some people, there are some things, information they don't have before. But this presentation are able to expose, when you begin to tell people what happened, look at the mechanism, what can really happen, what can really affect an individual. I think if out of 100, we can be able to buy the mind of 10 to 20, I think is an headway as a professional. Okay, so I will encourage every one of us as a professional, if we're at that level whereby during the course of our project, we'll have to make a presentation to the management team. So when we do a rescue plan, we need to make a presentation of things that are related to the rescue of worker in so many ways. It could be fire, it could be due to fall from height and all that. So things like this, when we do that, they will begin to see the real effects, or risk that are associated with all these things. It is only when we do that, most of them can see and buy in to our idea. I know most of us don't have the opportunity to sell this to our individual management. For those of us who have the opportunity to do that, we must continue to do that. It is only when we do that, they get exposed, they get informed, and they can provide resources to be able to manage such situation. Thank you.
Hello?
That's true.
Hello?
Yes, Mr. Francis. We
Okay.
called before. Go ahead.
Yes. Okay. I know time has gone, but I just want to throw more light on this suspension trauma topic of discussion today. This is a very nice topic, but from the other feedback I'm getting from other of our colleagues, I think, to my understanding, when we have a work at height that is above a certain level, maybe a critical work at height or special scaffolding or special height activity, this is where you are going to have implementation of a rescue plan. And I think the way some of us are addressing it, it depends on individual company compliance when it comes to issue of working at height and the necessary rescue process that needs to be available, that we give assurance to the personnel working at height. I will draw a very simple example from my company currently where I'm working, where we have trained rescue team, specially trained rescue team with approved rescue kit, and all these personnel working at height, first and foremost, they all have a suspension trauma attached to their harness belt. And this suspension trauma, we did a test run. We test run the process. First and foremost, we also did what is called, we ensure the suspension trauma is attached into this harness belt to an area where you can access it easily, because when you are working at height above, let me say, 6 meters, according to currently Ramco procedure, it becomes a special scaffold where you are going above 6 meters to 12 meters to 25 meters. There are procedures you must implement. Now, the suspension trauma is a key factor that not just using it, but if there is a fall, how visible you will be able to assess it. Because a man that is already falling is in a diverse different situation where even the suspension trauma, if you keep it in a blind situation attached to the harness belt in your body, you cannot even use it. So we must first and foremost ensure that, yes, the suspension trauma is kept in a visible place among individuals using it, so that when there is a fall, you can easily detach it and throw it for you to suspend, pending when the rescue process will commence. And yes, before such activity commence, sometimes we put the medical team phone number, mobile number on the rescue plan. Not that they are aware they are already aware that we are doing such critical activity on site, but no one is informing them on daily basis. But they are always alert. Anytime you call them, they will be at your point of emergency situation within a second, because their vehicle and every other thing is available in the vehicle. The driver is always there. So, and the medical doctors and nurses, they are always alert should in case of any emergency call is activated for them to respond. But before they are being called, the rescue team on site, they are there to give the first rescue process. So I wouldn't expect anyone to say, in my site, they are doing a job of a critical or a special scaffold or a special height, then your rescue kits are in the office. Why would they, in fact, why will you allow such a situation? You must ensure the rescue kit, they are available on site. The rescue team, some of them are even at height level to check and see what is going on, so that a rescue process could be activated and easily to save anyone in such situation. Because the suspension trauma as itself has a limit. Even the man who is suspended has a limit it can stay. I think it's within 10 minutes to 15 minutes. such a person must be rescued. If not, it becomes more dangerous for such victim. So I will employ and I will advise anyone here who is in the construction industry, where if there are certain tasks going on in your work location, the first thing you must ensure and you must enforce is the rescue kits. They must be available. The special trained persons must be available. If it's a radio or it's a mobile number you will use to call your medical team, you must ensure your data, your credit, and every other things are all intact so that you can activate it at any time if there is need for that. No one is praying for emergency, but it can happen anytime. So this is how I feel such a process should be managed. This is just my own little contribution. And currently in our work location here, this is how we are managing it. Seriously, in fact, to a point we sometimes if the rescue guys are not available, up to 4 persons will stop their job because we are not joking. We don't want to take anybody's life to play when it comes to height activity. Every height is critical.
Yes, thank you very much, Mr. Francis. I will quote you. Nobody is praying for emergency, but it can definitely happen. So we must take all proactive measures to ensure that we are ready. And when it happens, we are able to take action immediately. Mr. Andrew, your hand is raised. Is it?
Yes. Thank you. Mr. Francis, thank you for the contribution analysis. That's very clear. I just want to give testimony, testimony time. Yeah, I want to commend Safeoclock, Mr. Johnson, every other person, Olufemi. You're doing a great job. My testimony is that I was stopped by someone on the road, or like, and they mentioned my name straight. You are Andrew. I was wondering, tried listening to it, said, yeah, I saw your program. You people, you're doing a great job. Are you people paying for doing that? So as Mr. Justin, we always say, sorry, I'm still your name to Safeoclock. And I said, no, it's a way of giving back to the society. And, that's really gives me a lot of joy. I was very happy, and I came home very happy, like I was given a kind of a gift. Of course, it's a gift. So please, I want to thank all of you again for this platform and what you are doing. And your reward is on earth. Thank you. So that is just my testimony. And I pass the message to you all. Please encourage other young personnel to come and learn. They should come and learn. It is free. Tell them there are a lot of gurus here. They will learn a lot, and this will help our profession. That's this from me. Thank you.
Thank you very much, Mr. Andrew. I've actually had a similar experience. I went for a meeting. That was last Friday of last month. I went for a meeting, and in the meeting, somebody called me and called me Safeoclock instead of calling me my name. So I looked at him. He said he can only remember Safeoclock. So we interacted and we greeted, and he told me he watched my program somewhere, and he can only remember Safeoclock. So in a nutshell, whatever we are doing here is not just for us. Some people out there are learning from it. And for me in person, I'm also learning. I'm improving my knowledge. And most times you learn more by teaching. So while you teach, you learn more than even while you are listening. So as you are teaching, as you are speaking, you are reminding yourself and you are refreshing your brain as well. So let's keep the flag flying. Don't lose hope. And any other person that have a passionate topic that you want to discuss, you can reach out to me, and we'll allocate one day for you to to discuss, to lead the discussion. All right. We've stayed more than our scheduled time. Is there anyone that wants to talk, that is itching to talk before I close?
Yes. Good evening to. Well, I didn't raise my hands because during the presentation section, all my questions have been answered during the section, the presentation proper. So that's it. And that's why I didn't have to raise my hand or say anything, make any contribution. Once again, many thanks to the presenter. I mean, he did justice to the subject. Of course, I know this is one of his key area of expertise. So we are not surprised, and that's why I had to stay up late to tap from his wealth of knowledge. So, and I would like to also share a testimony from my end. Today, I wouldn't have been a proud member of IOCH or even a grudge IOCH member if not for this group, if not for this meeting, that's why I'm really, really grateful to the pioneers and, the frontiers of this session, more especially to Mr. Johnson, to Mr. Steven. Good, we have Mr. Olufemi here, Mr. Andrew. Thank you guys so much. You guys are doing an amazing job. We'll still keep on spreading the word out there for people to come and, benefit and tap from this. I've lost count of the number of CPD that I've acquired. I know when you go online on CPD, I know how much it costs, to get a CPD, but I was even amazed the very first time I made a request. I was hoping that maybe Mr. Johnson will come back and say, to support or something, for this whole period, for this lengthy time, I've gotten so much that I've even lost count. I'm really grateful and I really appreciate the work you guys are doing. The sacrifices you are making, it's not easy. It's not easy. It takes time to put all these things together, and you guys are very busy, of course, considering your primary place of assignment where you're working. We know you're very busy, but you still make out time, every Thursday to make sure you don't fail. Even most of us, we miss out, but you guys have been constant. So I pray God rewards your effort, reward what you're doing, and let's keep up the fire, the spirit going, and we will keep on inviting friends and loved ones to come and benefit from this platform. Thank you very much.
Thank you, Mr. David. And I'm so grateful and I appreciate every one of us who are here. We are increasing, we're actually increasing. Today we have an average of 15, 14. So we are actually increasing. And after now, more than 50 or 60 people will watch the video. So the message is going far. So let's keep encouraging ourselves, and everyone has something to talk and have something to give out and have something to learn as well. So we'll keep coming and we'll keep doing it. And we are saving lives and we'll keep saving lives. That is what we've signed up for. We are health and safety professionals. We've signed up to save lives. So we'll teach ourselves, we'll learn, we'll go to the site and we'll practice it so that we'll keep saving lives. So thank you guys for coming. And next week, Thursday, will be another time. Subscribe to our YouTube channel so that other people will be able to see our videos and be able to watch it as well. So thank you guys, and thanks for coming.
Thank you, Mr. Stephen.
Thank you all.
Thank you very much for organizing this seminar. And special thank Mr. Francis also to encourage us to join in this Safeoclock. Really, we joined from last 2-3 weeks, and we learn a lot of things from here. This is very good platform. I really appreciate all of you to organize this platform. And regarding my questions, also I get the answer from the presentation, as well as Mr. Francis also clear my some of doubts. So thank you very much.
Thank you. Thank you.
Thank you.
Yeah.